Hey folks, this is Dr. Vikas Reddy speaking about dental caries today. So, what is dental caries? There are a lot of things which you need to know about dental caries. First, it is the most common chronic condition which is affecting lakhs of people, okay, across nations, especially India and large population like India. So, it is usually costly in terms of time and work hours which is lost and money spent on to treating this disease. Again, there is a lot of history with dental caries. Even Aristotle, Hippocrates, and Shakespeare have also written on dental caries in their writings. So, dental caries can be defined as a microbial disease of the calcified tissues. So, you can say enamel is a calcified tissue in the structure of the tooth, characterized by demineralization of the inorganic portion and destruction of the organic portion of the tooth. So, basically, this is the basic definition. So coming to the epidemiology, if you go to any other village or a city now, out of any 10 patients you see at your clinic, or whether you go to a private clinic or a government general hospital or a primary healthcare center, out of 10 patients who visit the clinics, 4 to 5 people will have a caries tooth. So you can understand the severity of this disease. Okay, so coming to the geographical differences, there are a lot of geographical variations. So usually people having consumption of high carbohydrate diet and a lot of carbonated drinks are more prone for dental caries. There is family difference and some kind of familial history also which you need to consider. And gender-wise, girls show higher caries incidence than boys of same age groups, especially middle age group and elder age groups. So age, again, the caries doesn't have any age difference, but most of the time usually the caries teeth will start around 5 to 6 years in everyone's life. So you have to consider what is the classification of dental caries. There are a lot of classifications which have been put forward. So you have to just consider that whether it's a primary caries, recurrent caries. There are a lot of other classifications. You have to understand whether it's a residual caries or a root surface caries. So, or whether it's a recurrent caries or a secondary caries. This is the main classification which you can popularly listen about dental caries. So the first and foremost thing is if you visit a dental clinic, first the dentist will assess whether it's a simple caries or whether it's a compound caries or a complex caries. Simple caries is something where only one surface of the tooth is involved, whereas compound caries